The kids are typically intellectually impaired and they have a lot of behavior problems, including pretty severe hyperactivity, unusual hand mannerisms, tremendous anxiety, pretty significant language delays, so they have problems in communication. And most of them have significant social deficits so that they meet criteria for autism. When you diagnose one individual with Fragile X syndrome, you have a whole family tree to look at, because typically a boy with Fragile X syndrome or even a girl with a full mutation, the mother is the carrier. So this involves the whole family and often many individuals in a family tree.
When a baby with Down syndrome is born, these differences in appearance may be very subtle, and you might not even notice anything is unusual. Even so, most of them will at least have a few of the following characteristics: low muscle tone, or hypotonia, which can make them appear floppy, upward slanting eyes, a flattened face, particularly in the nose and mid-face area, small ears which are typically set lower on their head, a single crease across the palm called transverse palmar crease or simian crease instead of the usual two creases seen in typical babies, a short neck with excess skin folds, a wide gap between the first and second toes, also known as sandal gap, and an inward curvature of the pinky finger, which is known as fifth finger clinodactyly. Remember, not all newborns with Down syndrome will exhibit all of these features, but most will have one or a few of them.
Prader-Willi syndrome is a rare genetic condition that affects many parts of the body and brain. It is caused by some missing genes on chromosome number 15. Prader-Willi syndrome affects approximately 1 in 15,000 people, affecting both boys and girls across the world. Babies are unusually tired and weak. With a very low muscle tone, they need help to feed and often spend months with the feeding tube. Toddlers often take twice as long as other children to reach their milestones. Simple activities like colouring, riding a bike, and playing are very difficult to do. Many children develop problems with their hips or spine, often needing surgery to fix. Many children develop skin picking, which leads to persistent sores requiring hospital treatment. As the child gets older, they develop a chronic feeling of hunger. This leads to excessive eating, rapid weight gain, and can lead to morbid obesity. Constant supervision around food is necessary for the rest of their lives. People with Prader-Willi syndrome face many physical and mental health issues. They find any change in their daily routine very difficult to cope with. They suffer from extreme anxiety, often having meltdowns, become angry, and become obsessive about different things. This behavior is very difficult to manage. There is no cure for Prader-Willi syndrome. However, it can be managed, and with the appropriate treatments, it is possible to improve the overall health and quality of life of the individuals with the condition. Medical research is improving the treatments available, and with the right therapies, people with Prader-Willi syndrome can achieve their milestones. The help of healthcare professionals is essential to ensure that the treatments are effective. People with Prader-Willi syndrome will never live independently. They need very specific support and care 24 hours a day, 7 days a week, which keeps them safe from food. Access to this care can help to reduce the emotional and physical toll placed on carers and their families. PWSAI want to raise awareness and understanding of Prader-Willi syndrome. We want people with Prader-Willi syndrome to have a better quality of life. Great progress is being made, but there is a lot to do and we need your help. Please donate to help people with Prader-Willi syndrome and their carers get access to the best standards of care.
What is FAS? When a mother drinks alcohol during pregnancy, it may cause her child to have a group of physical and mental problems. Doctors call that group of problems fetal alcohol syndrome, or FAS. Children with FAS are smaller than other kids their age, their faces will look different, and they can have brain damage. Not all kids whose mothers drink during pregnancy will have all of these problems. Some children will have physical problems but normal growth. Other children will be very small but will have a normal-looking face. Still, all children with FAS will likely have learning and behavior problems that will last throughout their lives.